Welcome to Conversations. I'm Robin Farr.
And I'm Sean Alikian, and we're joined today with another very good guest. And I can't tell if Robin's trying to subtly send some hints here or not.
No, Dr. Soraya Esteva, and I'm getting it correct now, is the owner and medical provider of Silhouette Med Spa and Weight Management in Livermore. And we've talked with one of her colleagues before about the med spa part of it. I think we talked about laser and sort of some cosmetic things.
And that's a very big thing. It's very popular nowadays, these med spas.
Absolutely.
Yes.
It kind of takes the edge off of, weight loss
Aging
and the stigma and stuff like that, because it's a spa as well.
Yeah, exactly. But weight management, you're the one, Sean, who said this is a really great topic because we're always trying to lose a little bit of weight. I think you look fabulous.
We're always trying to lose it. What she means is I'm always trying to lose a little bit of weight because even the extra large shirts are starting to get a little tight on.
All right. Well, welcome to Conversations, Soraya. It's so nice to see you.
Yes.
Let's talk about, Sean is the typical, as am I, but when Sean said today I'm rejoining the gym, today I'm getting my life back. We say this, everybody says it on January 1st, but everybody is really constantly battling the bulge. What's up with this?
Absolutely. I think everyone wants to start on Monday, and everyone has good intentions to do that. And I think people do try to do that on their own. I think it also comes to a point where it ends up being too slow, or they're not satisfied. They get to a size that they're really not happy with. They start to, like you said, grab a shirt that's not fitting anymore. There's always a threshold, whether it's a number on the scale or a size that someone says, all right, that's enough.
I need some photograph.
Right.
Sometimes you see a photograph, you think you're looking okay, and then you see a photograph and you think, who photoshopped those extra pounds onto my thighs? I often ask that.
Well, for me, I came to the realization that this is, especially leading up to the holidays, now we're in fall and Thanksgiving's right around the corner.
Yes.
For me, it's now or never.
Yeah.
I don't feel like I'm fat or anything like that or obese, but when I go to the doctor and they use the antiquated, weight loss, the body mass index, he tells me I'm obese.
Right.
Believe it or not.
Exactly.
You're just wrong, and you just need a new doctor.
Yeah, but the BMI is an old school method, but it's now or never. And I think a lot of people, you said people start on Monday. I start on Monday morning, and I end by Monday afternoon. When you get a little stressed,
when you get a little hungry.
Yeah.
I think it's interesting. I actually enjoy dieting during the holidays, and I think it's a great opportunity to really slim down so that you don't overindulge, because what you start to notice is that people will bring in more and more food, and it becomes like a holiday, not just one day, it becomes every day of the week. Showing some restraint and then giving yourself the actual date of the holiday is great. And so I think another thing is people want to look their best for their holiday parties. They're going to see relatives who hadn't seen them. The last thing they want is their grandma saying to them, "Hey, you've gained some weight."
They say that. Older people feel like they have to have no filter.
The ugly sweater parties that you go to, the sweater is supposed to be the ugliest part of the party,
not your rolls in it. Exactly. Well, now, Dr. Esteva, have you ever had a weight problem? So when your patients come to you for weight management, can you know what they're talking about, or have you always looked like this?
Oh, you're so wonderful. Thank you for saying that. Like any woman, I'm an OBGYN by training. I really deal with the spectrum of women, from young women in their teens to postmenopausal women. And I see them go up and down. For me personally, it was after having kids, I gained, 30, 40 pounds. And I got to the point where I was like, I'm not buying another pair of shorts. This is it. Had done Weight Watchers, which I think is a fabulous program, done several diets. It was just so slow. And I think after a year of that, I couldn't eat another lean cuisine. I was just like, I'm so sick of this, processed food. And I didn't realize it. Couldn't eat apples either. At that point, I turned to the internet. I did not have my practice at the time. I was an OBGYN, but even as a physician looking online, I wanted something that was going to be detoxifying, something that was going to shed the pounds, and something that was different than the low-calorie, carb-based diet that I feel like Weight Watchers is. And that's when I stumbled across the HCG diet. HCG is a great detoxification in that you eliminate all the simple processed foods and the simple carbohydrates in your diet. And you get great results, and it's fast. I think that the important part is being able to go to your physician and seeing what diet is right for you. And we offer a variety of diets, and I'm there to kind of, one, relate to people, be like, I've been there, done that, and also provide them with the opportunity to make their own decisions and to help them along. Not everyone is going to be a good candidate for HCG. It's really strict. If you have 5 kids, you're running around, it might not be the diet for you. Then I would say, well, let's do some appetite suppressants, something that has some carbohydrates, so that if you need to go to Subway, if you need to grab something quick, you're not going to ruin the diet.
I want to talk about the HCG, but we'll do that after we come back from the break. Is there a mental component to overeating? I mean, we know there's emotional eating, but is there something that's almost like an addiction beyond our control? Because I feel sometimes that it's just not me eating all of that.
Absolutely. I mean, there's several studies that show that carbohydrates are addictive and they actually stimulate a part in your brain, which is very similar to alcohol addiction. I feel like people are addicted to carbs. And in the program, the nice thing about HCG, like you just said, you detoxify, you don't have any carbs. So typically when people on the first week of the diet are not hungry, they're just craving. They're craving the carbs.
They're just getting over their addiction. Just
Withdrawal
like,
type of thing.
that's it.
Absolutely.
Yeah. I'm glad you mentioned that, because it is there's a huge mental component to it. For example, just last week I was driving down the road and it was about 11:30 in the morning and I had just had a big breakfast, but I see the In-N-Out sign in front of me. And I said, you know what, it was already a stressful morning by 11:30.
Right.
And I decided to pull in and take a day break and eat a hamburger,
Right.
fries, and
Double.
a shake. And I
Right.
wasn't even hungry.
Right.
But I just wanted
You just
that taste.
craved
Yeah, I
that.
craved it and I wanted to just decompress a little bit. And that's huge, I think, because we've had a few guests on that are hypnotists that say that they can actually hypnotize and suppress those cravings and stuff like that.
Yeah.
So it leads me to believe, I don't know if it works or not, but it leads me to believe there's a huge mental component.
Absolutely, and I think that you crave it because it gives you the endorphins, the rush that when you're eating it.
Yeah.
There's
high.
there's pleasure sensors that are stimulated.
Right, and we've heard this about chocolate, and you're a chocoholic. We
big
can
time.
admit that,
Big
but
time.
there's some very satisfying, some chemical reaction that's going on in your brain when you eat chocolate.
Yeah.
It happens for me with wine.
I'd like to find out what it is so I
Happens
can
for me
put my
for baked
finger on it.
goods.
Oh,
I mean, come on,
baked goods,
we're all
yeah.
yes,
We're all
of course,
human, and
we're all
that's living. We
humans.
need this for living. Let's come back and talk about the HCG diet, because I think it's had some controversy.
Right.
And yet, boy, if you want quick results, that's the way to go. And I think a lot of people do want results fast. We're kind of in a results-driven
Well, that's what keeps you
society.
going.
Exactly. When you get on that scale. Yes,
Right. Well, that's
Dr.
actually a good point.
Soraya Esteva, owner and medical provider at Silhouette Med Spa and Weight Management in Livermore. You can check out their website, www.silmedspa.com. Don't go away. Sean and I will be right back with plenty more about weight management.